My name is Pip. My name is Pip Brennan, and I'm the Executive Director of the Health Consumers Council. And I was challenged some time ago to, in 5 minutes or less, explain about the Sustainable Health Review and basically why should consumers share. So it's taken me a while to accept the challenge, but here, September 2021, I have taken up the challenge. So the Sustainable Health Review was a report that was released in April 2019 after about 18 months' work. And there were actually 30 recommendations. You can see recommendations 1 to 15 on this page and 16 through to 30 on that page. You can also see at the top these enduring strategies, of which there are 8. I have highlighted recommendation 4. This is because it's one of those really important ones, and it cuts across all recommendations for the Sustainable Health Review, citizen and community partnership. So these are some of the reasons that I believe that consumers need to be interested in the Sustainable Health Review. So I've talked about that. First one, there's recommendation 4 dedicated to enhancing citizen community partnership. It is our current best chance to develop and expand consumer and carer involvement in WA's health and social care sector. So transparency is that disinfectant that really helps create behaviour change, and this is threaded right throughout the Sustainable Health Review. So a few ones, recommendations 4, 16, 20, 21, all of those talk about transparent reporting. There's an acknowledgement in the Sustainable Health Review that that you need to think about other things such as housing and poverty and so forth when you're thinking about health. So there's actually a recommendation, for example, 3A, which 3A specifically talks about poverty. So the Sustainable Health Review cannot be implemented by health alone, because it really requires attention to all aspects, all social determinants of health. There is this collaboration is required in order to make the Sustainable Health Review happen. And so that's that. It's really all about, the relationships and the partnership that will drive this, this piece of work through to implementation. It sets a concrete goal for how much investment in prevention needs to increase. I think we all understand that if we continue doing what we've always done, we'll always get what we've always got. We can see every single day there's the systems under stress. We at some point will have to invest in prevention in order to stop people going to hospitals because their issues have been dealt with elsewhere or prevented altogether. So this articulates by 2029 in July, it has to be increased to 5%. It's around about 1% at the moment. So it does actually articulate a fairly bold goal. It hasn't forgotten about environmental sustainability. Recommendation 5 speaks to that, and there is a very passionate community of practice who are really driving that work. All the way through putting the report together, we talked about transparent reporting, and so that is just beginning to start happening. So say, for example, you can see recently there was talk about significant progress on the voluntary assisted dying, digital health, mental health, future health and research and innovation fund, public health investment, different partnership approaches. And while a lot of this work is happening anyway, what the opportunity is with the Sustainable Health Review is to really bring thinking together right across the system and try and move things forward so that we are transparently reporting on what's actually happening. So as mentioned, that this work is evolving. The Health Consumers Council is really interested in that idea of like a recommendation watch, not just about the Sustainable Health Review, but about other key reforms like, the mental health, drug and alcohol plan, the state disability plan. There are many plans out there. It has been talked about as a pandemic. And I think, as consumer bodies, our focus needs to be on implementation. So how has this impacted on your journey as a consumer rep? The truth is it may not have really reached your Consumer Advisory Council or District Health Advisory Council or other committee or group that you're involved in. It's my hope as co-lead on recommendation 4 that this is going to change. There is a forum coming up on the 22nd of October, which invitations will be coming out soon. So I'm hoping you'll consider getting involved. A space is being set up on the Health Engagement Network. This is a 10-year program and it really is just beginning. So this, as I say, this is our best chance as a state to really drive forward consumer involvement. So thank you for your time, and I look forward to seeing you at some point soon around the Sustainable Health Review. Thanks. And we will be doing videos for each of the recommendations.